After you determine there's primary MR present, the next major step that informs decision-making is determining, is the patient symptomatic from this or asymptomatic? If they are symptomatic, it is a class 1 recommendation to perform surgery if they are acceptable risk for surgery. However, if they're high risk or prohibitive risk, a transcatheter edge-to-edge repair has a class 2A recommendation. When we look at the asymptomatic category, there's a couple different differentiators here. If a patient has LV dysfunction with an EF less than 60%, it's a class 1 recommendation to intervene on the mitral valve at that time. If they have a normal EF, but repair success likelihood is greater than 95% with a predicted mortality less than 1%, it's a class 2A recommendation for mitral valve repair at that time. The last category is that if you have a patient with normal LVEF with a progressively increasing LV size or decreasing LVEF on 3 or more serial studies, it's a class 2B recommendation to intervene on the valve at that time.